Hi everyone. The assessment that Amanda and I got assigned to is called the Executive Function Performance Test. First, what is the purpose of the assessment? Also known as the EFPT, it is to assess executive function deficits in the performance of real-world tasks, specifically evaluating initiation, organization, sequencing, safety, and judgment, and task completion. When it comes to the target populations, the EFPT mainly looks at adults with stroke, traumatic brain injury, individuals who have schizophrenia, and mild cognitive impairments. It can also be used on adolescents, ages 14 years or older. When it comes to the setting and practice area, the EFPT is typically used in rehabilitation and clinical settings, such as inpatient and outpatient rehabilitation centers, occupational therapy clinics, community-based programs for older adults, or individuals with cognitive impairments. And it can even be used in home-based. Regarding the practice areas, the EFPT is used in occupational therapy, neurorehabilitation, cognitive rehabilitation, and geriatric centers. Testing procedure, the EFPT evaluates executive function during 4 real-world tests. So, cooking oatmeal, using a telephone, taking medication, and paying your bills. Now, you may be wondering how this procedure works. You will introduce the test to the client and ask them to perform it as independently as possible. Then you will observe their initiation, their organization skills, their sequencing skills, their judgment, and their safety. Lastly, their completion for each task. The standardized queuing system will be used to prompt when necessary. It goes from 0 to 5 for the queuing system. 0 means there's no cues required. The participant completes the steps independently. 1 indicates that there is indirect verbal guidance, which also means there's a general prompt is given to help the participant recognize an error or prompt them to think about the next step. For example, you would say, is there anything you need to do first? For 2, if you get a grade as 2, that suggests that you have a gestural guidance. So this means that the assessor points or uses a nonverbal action to guide the participant's attention toward the correct object or task component. If you grade a 3 on the queuing system, this indicates direct verbal assistance. Therefore, the assessor provides specific, explicit verbal instructions on what to do next. If you get graded a 4 on the queuing system, this indicates physical assistance. So the assessor physically guides the participant's hand or body to help them complete the step. Lastly, if you get a 5 on the queuing system, this means that do for the participant, such as the assessor must perform this step for the participant because they are unable to complete it, even with maximal assistance. Then you will calculate the total EFPT score by taking the sum of scores across all of the domains and tasks. If you receive a higher score, that indicates that more assistance is needed. However, if you receive a lower score, that indicates greater independence. When it comes to the access, the cost, the materials, and administrator training, the manual and score sheets are available from Washington University OT program. Tasks require common household items, so you would need a microwave or a stove, oatmeal, you would need a phone, you would need bills, medication bottles, and writing tools. So cost. As of 2025, it is free if a client has all materials. However, it's usually $50 to $100 kit, which contains materials if a simulation is being used. For administrator training, there's a free manual available on how to properly queue patients for tests. For recommended, occupational therapists or OT students are trained in cognitive assessments for this test. The training involves reviewing the manual, practicing queuing system, and scoring sample tasks. When it comes to the reliability, measures, and clinical utility, the inter-rater reliability median, which equals 88% agreement. Then you have the test-retest reliability, good in TBI and stroke populations. And I also found the internal consistency, which is the Cronbach's alpha, which equals 0.94. For validity, the construct validity is the EFPT performance correlates with other executive function measures. The criterion validity, this test predicts functional independence in daily life. Clinical utility, It's sensitive to subtle executive deficits, and it is usable across multiple diagnoses. For strengths, standardized real-world tasks, objective scoring, it identifies specific areas of executive dysfunction. The overall summary and reflection, so the strengths and weaknesses that Amanda and I thought about when it came to reviewing this test. The strengths of the assessment is that it directly assesses executive function in meaningful real-world tasks. It is standardized and reliable across multiple studies. Lastly, it can show specific domains of deficit for treatment planning, and it is publicly available at no cost. The weaknesses of the assessment is that it is time-consuming. It is typically around 30 to 45 minutes to administer all tasks. This assessment requires administrative training for accurate cueing and scoring. And also for a patient who just suffered a TBI, for example, a patient who suffered a stroke, they may not want to be there for 30 to 45 minutes. So you as an OT or an OT student would have to take that into consideration. Lastly, some of the tasks may not be fully relevant in all cultural contexts. For the reflection aspect, the EFPT is an important OT tool for assessing executive function and planning interventions. Its real-world tasks make it extremely functional and client-centered. And now we will be moving on to the demonstration video. And thank you so much for listening.
So today I'll be asking you to make some oatmeal, use a telephone, take some fake medication, and pay some fake bills. You may not be doing these tasks at home, but they have been selected for this test as representing those most like daily tasks. If you need help at any point in this test, let me know. This is an assessment and I will respond to questions that you ask me, but will not have a conversation during the test. I wanted to let you know so you would not think I was not friendly. All the items you need to do these tasks are here in the box. I want to know a few things about you before I begin the testing, so I'm going to ask you a few questions. Please answer them as best as you can. Do you cook?
Yes.
Do you use the stove to cook meals?
Yes.
Have you recently made oatmeal on the stove?
Yes.
Will you be able to make oatmeal? 0 by yourself, 1 with verbal guidance, 2 with physical assistance, or 3 I won't be able to do this task?
0.
Do you use the phone on a regular basis?
Yes.
How many times a week do you use your phone?
I would say daily, so 7.
What is the phone number you call in an emergency?
911.
Will you be able to make a phone call? 0 by yourself, 1 with verbal guidance, 2 with physical assistance, or 3 I won't be able to do this task?
0.
Do you take medication?
Yes.
Can you tell me where you keep your medications?
Yes.
Okay. When do you take your medicine? 1 morning, 2 afternoon, 3 evening, 4 before bed, 5 more than once a day, or other times, like twice a week?
Once.
Will you be able to take the medication? 0 by yourself, 1 with verbal guidance, 2 with physical assistance, 3 I won't be able to do this task?
1.
Do you pay your bills?
Yes.
Does someone help you with your bills?
No.
Have you ever used a checkbook?
Yes.
Do you know how to use a checkbook?
Yes.
Will you be able to pay the bills? 0 by yourself, 1 with verbal guidance, 2 with physical assistance, 3 I won't be able to do this task?
1.
So for the first task, I want you to make oatmeal. The instructions are on the oatmeal box, but here is an enlarged version of the instructions if you need them. Instructions. Please read the directions to me so that I know that you understand what is it that you are to do. Follow these directions, and when you are done, put the oatmeal in a bowl. The items you need are in a box.
It says step 1, add 2 cups of water to your pot. Bring water to a simmer. Step 2, add 1 cup of oats to the pan and bring to a simmer. Cook the oatmeal for about 5 minutes or until it has reached the consistency of your choice.
Upon completion of the task of making oatmeal, the patient was independent in organization. She was able to obtain all the ingredients needed in the correct order prior to starting her task. She was also independent with sequencing, as she completed the task in the correct steps that were provided to her. And she was also independent on judgment and safety. She was able to turn off and on the stove appropriately and hold it correctly to avoid burning. The patient did not wash the dishes, but that is optional. So overall, she was independent with this task. So next, we're going to use the telephone. So I want you to look up a local grocery store in the phone book. Telephone them and ask them if they deliver groceries. Let me know what you find out. The items you need are in the box. Put the phone on speakerphone so that you can hear that the number has been dialed and hear if you need to cue them.
Hi, how are you? I was just wondering if you guys deliver groceries. Okay, perfect. So I just have to spend $100 and then you guys deliver the groceries? Okay, thank you. Bye.
So the patient was independent in this task for organization skills. She was able to access the tools and the materials needed to complete this task. She also was independent with sequencing, and she performed everything in the correct order and was also able to respond to me and let me know exactly what they had said. I need you to pretend to have a prescription in the box. Find your prescription and do what the instructions tell you to do. The pills in all of the bottles are safe as they are sugar-free candy. What times during the day are you supposed to take this medication?
In the mornings.
What are you supposed to take with this medication?
Water.
What do you need to be careful of when you take this medication?
I can't drink coffee for 30 minutes. So I have to take 2 of these. I'm gonna go and get my coffee.
Remember, you can't.
Why?
You have to wait 30 minutes in between.
Oh, I forgot.
Patient was independent with organization. She was able to gather all the tools and materials that she needed to successfully take her medication. For sequencing, she also made sure she looked at the bottle, read it prior to taking it. But for judgment and safety, she forgot that she was not able to take the medication with coffee, that she had to wait 30 minutes apart. So she needed some verbal guidance for that one. So she would get a 1 for that one. Okay, Kristen, for this last task, I want you to take what you need to pay the bills out of the bag. Find the bills, open the bills, pay them, and balance the account. These are fake bills, and this is not your account, but I need you to pretend that these are your bills and your account, as this is part of the assessment.
And this is my checkbook. So the first bill is my light bill. It's actually past due because it says it was due on September 8th of 2025. The total is $50.25. So I'll write it in my checkbook, although it's past due. I'll mail that one out. And now let me get my other one. This is the phone bill. This one is due on October 31st, 2025, so I still have time. And this one is $100.30, and I'll mail that one out right now as well.
Okay. So overall, the patient was independent with organization task, sequencing, as she did it in the correct order, and judgment. Okay, Kristen, so overall you did a good job on your executive performance test today. You were mostly independent with all of your tasks. Just remember when taking your prescriptions to read the precautions prior.
Thank you.
You're welcome.
Have a good day.